In the third section of our lecture topic, normal fetal development and growth, now we will talk about the development of fetal body systems. In this, we will talk about the development of skin and homeostasis, blood and immune system, and also development of special senses and behavioral states. First, the skin and homeostasis. Fetal skin protects and facilitates homeostasis. Homeostasis is an important function of the skin, protection and homeostasis. And homeostasis is to keep the body in balance. That balance is maintained by the skin. Then skin and its appendages develop from ectodermal and mesodermal germ layer. There are three layers, we said: endoderm, mesoderm, and ectoderm. Ectoderm is the outermost layer, mesoderm is the middle layer. So skin is formed from the ectoderm, but skin and appendages are produced or formed both from the ectoderm and mesodermal germ layer. The appendages of the skin are hair, and then we have the nails, all these skin and its appendages. It's covered in the appendages. So main function is protection and homeostasis. If you see the diagrams, different structures, production first is the periderm, and then there is formation of basal epidermis layer, and then periderm is around the skin. So first the periderm is formed, and then the basal epidermis, and then in the second stage periderm, and then in between periderm and epidermis there is formation of keratinocytes. Keratin is the pigment of the skin, and keratinocytes are the cells that produce that pigment. So this is in the second stage. Then in the third level, you see now periderm is no longer present, and then we have the keratinocyte, which is now increasing, and then we have basal cell bud formation. This is the epidermal layer is from the bud hair, and this is the primordial hair follicle from which later on the growth of the hair takes place. Then also in the next stage we have keratinocytes, and then the basal cell bud, hair follicle, and then at the end of this bud now we have the formation of mesenchymal cells. In the next stage again, keratinocytes are enlarging, hair follicles are present, and then there is slowly the hair is coming out, and then there is sebaceous gland formation. Hair follicle, basal cell bud, primordial, now eccrine glands are forming, and then we have the sebaceous gland also. And then again eccrine gland, hair follicle, sebaceous gland. That's how the skin and its appendages, hair, and then the glands including sebaceous glands, and then some other eccrine glands are produced here. So basically all this takes place from the basal epidermis layer, and then there is production of also keratinocytes which produce the pigment keratin, and then the basal epithelium layer or basal epidermis here. This basal epidermis is later on form the hair follicle, and then we have the sebaceous gland and eccrine gland, all develop from basal cell layer. Next, the blood and immune system. Blood and immune system is derived from pluripotent hematopoietic cell. Hematopoietic cells are the cells responsible for the formation of the blood. Hemato is for the blood, poietic is the forming cells, blood forming cells. Development of thymus and lymphoid organs. Blood is formed also in the thymus, lymphoid organs. They are mainly responsible for the immune system. Thymus is at the onset of puberty, the thymus is atrophies. So this is the gland present in the neck that is responsible for immune system and T cell formations, and also the lymphoid organs like tonsils, lymph nodes, all these are formed. T cell precursors transmit to thymus by 9 weeks of gestation. So T cells are the cells responsible for the immune system, for protection against different infections. So if you see T cells, cells that are responsible for the production of T cells, they are transferred to thymus by 9 weeks gestation. So immune system again start developing pretty early in the fetus. Readily found by 12 to 14 weeks in spleen and lymph nodes. So T cells are present at 12 to 14 weeks in spleen and lymph nodes. Both spleen and lymph nodes are the lymphoid organs. Complement proteins are usually present in the middle of the second trimester. So blood is produced from hematopoietic cell, and then there is immune system is developed by the formation of thymus, spleen, lymph nodes, and all that occurs by about 12 to 14 weeks gestation, and then the T cell formation takes place at about 9 weeks of the gestation. These are you can see this is the placenta, and then uterus, the mother's blood, and the baby's blood. And if there is incompatibility between the mother's blood and the fetus blood, ABO incompatibilities and RH incompatibilities, lot of complications takes place. So it's always good to do the blood typing of the mother and the baby. Fetal IgM and IgA do not cross placenta. So two type of immunoglobulins, IgM and IgA, which are present in the baby, do not cross the placenta. So you won't have them in the maternal blood. Next, the fetal hemoglobin. Hemoglobin is the present in the red blood cells, and hemoglobin is responsible for the transport of oxygen, and it gives color to the blood. So hemoglobin is very, very important component of the red blood cells. It gives color and is responsible for the transport of oxygen. The fetal hemoglobin is different from adult hemoglobin, which is hemoglobin A and hemoglobin A2. Two gamma chains, 2 alpha and 2 gamma chains are present. This is the fetal hemoglobin, 2 alpha and 2 gamma chains. Thalassemia is a condition in which there is abnormal hemoglobin present. Hemoglobin is reduced or absent production of one or more of the globin chain of hemoglobin, beta thalassemia major and alpha thalassemia. Two types are present. We have thalassemia major and minor. This is abnormal hemoglobin present, and it's a bad condition. There is abnormal malformed red blood cells are present, and the patient usually malformed red blood cells are easily destroyed. There is anemia, there is pallor, shortness of breath, tachycardia, all these complications are present. So thalassemia is a condition in this there is decreased or absent production of one or more of the globin chains, globin chains, two gamma or globin chains, and this leads to abnormality known as thalassemia. Next, the development of special senses. Special senses are the sense of hearing, sense of vision, sense of smell. These are the special senses. So hearing, auricle is the outer ear, and then external auditory meatus. This usually takes place at about week 7. So week 7 of the pregnancy, this is the 17th phase of pregnancy, 19th and 23. You can see there is development of the ear and special senses. 10th week onward, external ear is formed. 18th week, there is middle ear and 3 ossicles, which are incus, malleus, and stapes. And this is the inner ear labyrinth. And at about 24 weeks, cochlear and the membranous and bony labyrinth is formed. So, special senses. 10th week, external ear is formed, then at 18th week, middle ear, and then 24th week, cochlea and inner ear. So roughly at about the end of the second trimester, there is development of special senses. Fetal eye movements can be observed during pregnancy. Next, the behavioral states. In the first trimester, beating of fetal heart, and there is breathing movements. First trimester, breathing and heartbeat is present. And as we mentioned, the first indication at about 4th to 5th week of gestation is the presence of flickering heartbeat. So first trimester, both are present, heartbeat and breathing movements. Then there is movements of arms and legs, yawning, sucking, and swallowing. In the second trimester, cycles of absence or presence of movement change. Then fetal behavioral state, first is quiescence. In the beginning, there is no movement, and usually after at about 16th week, there is fetal movement starts, and there is feeling of the fetal movement by the mother. So first, fetal behavioral state, quiescence. Then in the second, there is frequent and periodic body movements with eye movements. Then in the third phase, there is no gross body movements, but eye movements are present. And then in the fourth, vigorous continual activity. As the baby grows, more and more movement is felt by the mother. So first, quiescence, no movements. Then there are frequent and periodic body movements with eye movements. Then there is no gross body body movements, but eye movements, and then vigorous continual activity. These are the different fetal behavioral states. So that was all about section 3. Thank you for watching sqadia.com.